September was one of the most strenuous months for Ballad Health in the COVID-19 pandemic. The health system hit record highs for not only hospitalized patients with the virus, but for those in intensive care and on ventilators.
And the numbers tonight remain high. 285 in-house COVID patients, 76 in intensive care, 60 on ventilators. News Channel 11's Bianca Murray spoke with the Southwest Virginia respiratory therapist who's continuing to work on the front lines.
That's right. Heather Long has worked in one of the nation's busiest black lung clinics and in some of our area hospitals. So she's no stranger to people having difficulty breathing, but she says she's never seen anything like this Delta wave before.
If you've worked in the field as long as I have, you deal with a lot of death, but never this amount of death and this many patients at one time.
Long recalls the emotional toll of having to intubate someone.
A lot of people are panicky because they can't breathe, the equipment's dinging in the background because their oxygen level is low, and it's sheer panic on their face. And we have to try to go in and look like the calm ones when really, we're scared and everything as well.
Knowing no other options are left means the therapists have to put emotion aside.
You can't think about anything else. You just the goal at hand. I've got to take care of this patient. This is what we got to do. And then you can have your moment later.
Long says she's now taking on tasks she's never had to before, like keeping tabs on equipment.
Eventually, I hope we never get to that point, but we could run out of equipment. And it's a very daunting feeling having to keep up with those numbers because I've never had to do that before in my career.
Those moments are heavy with the knowledge of what often comes next.
Unfortunately, when you get to that point, we don't see a lot that, are extubated and come off, and it's just not a good outcome when they get to that point.
Long says that's creating an exodus in healthcare, one she understands.
We're just so tired and I don't know how much more we can go. It's really changed a lot of people in healthcare because now you're seeing nurses, respiratory therapists leave the field that you thought would be there until they retired, but they just can't take it anymore.
Overwhelmed by many things, including being there when a patient's own family can't.
Family couldn't visit, so we became their family. And we were the last people that most of them spoke to before they got put on the ventilator.
Tomorrow we'll wrap up our series on COVID-19's impact on Southwest Virginia with a focused look at the low vaccination rates in the region.